Hello, my name is Dr. Michael Wynn, and I'm an orthopedic surgeon here at OrthoVirginia specializing in hip and knee replacement surgery. Today I wanted to talk to you a little bit about minimally invasive anterior hip replacement. Hip replacement surgery is a phenomenal procedure that over the last 50 years has literally helped millions of Americans and people around the world overcome pain due to hip arthritis. Hip arthritis is a debilitating condition caused by loss of cartilage in the ball and socket joint. The loss of cartilage results in inflammation and pain in the patient's groin, pain in the thigh, limping, inability to perform normal activities. It's a quite debilitating condition, and hip replacement generally provides excellent outcomes and great results for our patients. This is a hip replacement prosthesis, and this is the prosthetic cup. So during a hip replacement surgery, the joint would be exposed, the arthritic ball of the ball and socket joint would be removed, the cup would be prepared for a titanium shell followed by plastic or polyethylene liner to be placed. The femoral bone would be prepared for a titanium stem that has a prosthetic ball that attaches to it. The joint is reduced and placed, and this is what a hip replacement entails. The real question is, how is the procedure performed anatomically? I'm going to use this model to demonstrate. So in a traditional method, hip replacements are performed through a posterior approach. This is the most traditional method of hip replacement surgery. In this approach, an incision is made on the back of the hip through the buttock musculature. In this model, the gluteus maximus, which is the main musculature of the hip, has been removed for demonstration purposes. However, with a posterior approach, an incision is made through the gluteus maximus, splitting the muscle, followed by cutting of all of the short external rotators from the back of the hip in order to expose the hip through the back. Due to the fact that the posterior structures have been violated, there's a higher risk of dislocation. Furthermore, there's significant violation of the soft tissues of the back of the hip, which I believe results in prolonged recovery times and more pain after surgery. The patient during a posterior approach is on his or her side, so it's difficult to check x-rays in real time and get feedback on component size and position. I like to use x-ray during the case to make sure there's no errors in component size and position. And with a posterior approach, that's very difficult. The alternative approach, which I prefer and I've been performing for well over a decade now, is a minimally invasive anterior approach. In this approach, the patient is flat on his or her back, and a small 4-inch incision is made on the front of the thigh. Dissection is carried down through a natural muscle plane. There's a natural space between the major muscle groups in the front of the thigh where the hip can be exposed without cutting any significant muscle. The front of the joint can be exposed, and the arthritic ball can be removed without difficulty. The socket is then easily exposed and prepared with placement of the prosthetic socket and plastic liner. The femur can then be exposed, and the femoral stem can be placed, followed by the prosthetic ball, and the hip was reduced, thereby completing the hip replacement procedure. During this procedure, x-ray can be brought in and used in real time to check component position, component size, leg length, thereby really minimizing the risk of error and component placement. Furthermore, I believe that with anterior approach minimally invasive hip replacement, patients have overall much less pain, better strength, and quicker return to activity. Each year, I perform literally hundreds of anterior approach total hips at our ambulatory surgery centers where patients have surgery. They're usually up walking within an hour of surgery and home within a couple hours of surgery. And I've been very impressed over the years with the results that the anterior approach gives in hip replacement. In summary, I think the anterior approach is the most minimally invasive approach for hip replacement surgery. It offers a clear answer for patients suffering from hip arthritis and pain. And if you have questions about hip arthritis or want to learn more about the anterior approach, please feel free to reach out to me or my office or OrthoVirginia, and we're happy to answer any of your questions and help you along in any way that we can. Thank you very much.